Now we will be doing the anatomy of the skull, and in this anatomy video of the skull we will see the different parts of the skull in different videos. So we'll discuss the whole of the skull, the intracranial portion and this vault in 4 to 5 videos along with the clinicals. अब हमने skull को देखना है. This is the vault or this is the cap of the skull, and it is very simple. और इसका एक इंट्राक्रेनियल पोर्शन है और एक इसका एक्स्ट्राक्रेनियल पोर्शन है. Now coming to the extracranial portion first, it's looks like a cap. It's known as calvarium, and this calvarium comes from the Greek language of bowl. As you can see, it's a bowl shaped. This calvarium has got different bones which fuse it starts from the age of 30 to 40 years, और complete fusion हो जाती है by the age of 70 years. And now you can see that ये एक young skull है जिसमें fusion sutures की वजह से हुई है and complete fusion नहीं हुई हुई. So ये चार bones हैं जिसको different sutures ने जोड़ा हुआ है. The first one, the anterior one, is the frontal bone. The lateral two on the middle and the posterior aspect are the two parietal bones, and you can see one bone on the posterior aspect, that is the occipital bone. Now coming to the sutures which are dividing the bones and which are making the junctions with one another are, the first one is the frontal suture. As we can see, this frontal suture starts from here and takes a semicircular path and ends at here. Now the two parietal bones are joined to the frontal bone by these frontal sutures, and the two parietal bones are joined with one another by this sagittal suture. And the occipital bone is joined to two parietal bones by the lambdoid suture or the coronal suture. Now there are different junctions at these sutures, and हम देखेंगे कि बहुत सारे जंक्शंस आएंगे स्कल में, बट जो वॉल्ट से जिनका ताल्लुक है वो दो बहुत इंपॉर्टेंट सूचर्स हैं, जंक्शंस हैं. वन इज बिटवीन द frontal suture and the parietal suture, that is known as the bregma. This is the bregma. This here is the bregma. You can see there is the parietal suture which is joining with the sagittal suture which is joining with the frontal suture, and the second one is with the occipital suture joining to the sagittal suture. And if we see it in correct position, we will see that it is of shape of a lambda, which was used for the wavelength in physics. It is used as a lambda. It is lambda shaped, so it is the lambda, and this is the bregma. This is the superior aspect of the vault. You can see it is very smooth surface. This is some pathology, or I don't know, something that is abnormal which should not be there, and elsewhere it is very smooth, and all of the bones are very smooth and they are not rugged and do not have any impressions. Unlike to the superior aspect, on inferior aspect we see different foramina, different crests, different grooves. And in this internal structure we'll start from the midline, and then we'll deviate from the midline towards the lateral side and see what are the structures which we come across. The first one which we are seeing is the frontal crest, that is anteriorly the frontal crest is there. This frontal crest is a point where the falx cerebri, which is a fold of the dura mater, is attached, and which divides the cerebral hemisphere into two and goes down into the longitudinal fissure of the two cerebral hemispheres, which we will discuss in meninges or will not discuss. But this is the frontal crest, and as you trace down the frontal crest, the distance between the two, I'll use a different the distance between the frontal crest is increasing the two lips are created. It started as a crest, but now there are two lips that are created, which are not prominent in the middle portion, but in the rear portion you can see that these are very prominent, these two lips. So actually, why is this and how is this and what is the significance is that this groove that is in between houses the superior sagittal sinus, and as the tributaries are coming from here and superior cerebral vein and the emissary veins, as these veins are coming joining the superior sagittal sinus, the superior sagittal sinus is widening. So it is at the posterior aspect, the sulcus, superior sagittal sulcus, which houses the superior sagittal sinus, is becoming wider, and two lips are created of the superior sagittal fissure, and to these lips again the falx cerebri is attached, and between the fold of the falx cerebri we have the superior sagittal sinus running. Now at the posterior end, this is the area approximately where the superior sagittal sinus will end or will just continue or it will deviate. As we will discuss later, this is the area where the occipital bone has started. This is again the lambda from the interior side, and this is the area from which the superior sagittal sinus will deviate to the right side, or it will join the confluence of the sinuses. On the lateral side of this superior sagittal sulcus, we can see different fovea, and fovea is a blind-ended pouch. So these are not foramina, these are the fovea. This in green, encircled in green, this encircled in green, and this larger one is a fovea. It's not a foramina. The difference between the foramina and a fovea is that foramina is not blind-ended. It's a communication, whereas the fovea is not a communication. And as you can see that there is no foramina, so it's a blind-ended. It ends somewhere in the tables of the cranium. So these foveolae are there for the arachnoid granulations. So they house the arachnoid granulations, so they are known as granular foveolae. As we move downward, we cannot see here, but there are two parietal foramina located adjacently to the superior sagittal sulcus, but anteriorly to the occipital bone. This is approximately the location of these parietal sulcus, and they emit the emissary veins, parietal foramina that emit the emissary veins that join the superior sagittal sulcus. So there will be the emissary veins which will join the superior sagittal sulcus. On the most lateral side, there are grooves which are in red. These are for the meningeal arteries, and these grooves are of the middle meningeal artery. And this middle meningeal artery, as you can see, it's making a very close relation with the cranium. It is often ruptured in the head injuries, and epidural hematomas are created which raise the intracranial pressure, and if not treated surgically are lethal. So these are the anterior and the middle meningeal arteries, anterior and middle branches of the middle meningeal arteries that are making the grooves here, and which will supply the meninges of the brain. Thank you.